In this lesson, we'll take a look at some of the common upper respiratory infections. We'll take a look at infectious rhinitis, this is basically the common cold, sinusitis, laryngeotracheobronchitis, you may know that one as just croup, epiglottitis, influenza or the flu, and then scarlet fever. So let's start with the common cold, again, also known as infectious rhinitis. Whenever you hear rhino, pertains to the nose, believe it or not. So the pathophysiology, this is a viral infection, right? There's more than 200 possible different viruses that could give us a cold. The most common group is called the rhinovirus, and it's basically spread through respiratory droplets. Somebody coughing or sneezing, in your vicinity, that type of thing. That's why it's just so important to to wash your hands and to cover your mouth when you cough, that type of thing. So we basically all have had a cold. Some of the clinical manifestations are going to be nasal congestion, right? Just kind of like a stuffy nose. The term for runny nose is rhinorrhea. Okay, so that's basically a watery discharge that comes from the nasal cavity. When we do have nasal congestion, a lot of times people will have to breathe through their mouth. Possibly a sore throat, headache, a mild fever, really not too high, 100, something like that, 99 or 100, and then malaise, right? Just don't feel well. As far as the treatment, there's really not much that we do for the common cold, just symptomatic treatment, whatever makes somebody feel better. Now, it is possible following a common cold or an infectious rhinitis to get a secondary bacterial infection. That's when, like streptococcus, invades the area of inflammation where we have the cold, the tissues are inflamed, and now we have a purulent exudate, right? Kind of remember white blood cells to form the purulent or pus. Systemic signs would be a higher fever, that type of thing. So this is a pretty good picture. Here they're showing you some of the things that happen when we have a viral infection, such as the flu or the common cold virus. And basically what they're showing you here is that the virus is going to attach to the respiratory mucosa. So this diagram here represents a healthy mucous membrane. When the virus attaches to the mucous membrane, it's going to cause inflammation and necrosis to some of the mucous membrane, some of the tissue, that type of thing. And this inflammation is going to obstruct the airflow. So here they're showing you from this picture, we have good airflow, to this picture here, where there's inflammation in this area, we're now going to have poor airflow. And that's going to be presented as congestion or obstruction of the airways. Now, viral infections, especially in the upper respiratory, the cold area, the nasal cavity, the pharynx, that type of thing, can spread to other areas, right? Viral infections, say from the pharynx, can spread to the ears. When we have an ear infection, that's called otitis media. They can spread to the sinus, known as sinusitis, right? And they can even go down to the bronchi. That would be like a bronchitis, and then even all the way down to the lungs, where we would have something known as a pneumonia. Right? So it is possible that the virus can spread along this mucous membrane that just lines the whole respiratory tract. And then we can also get, like I said, a secondary bacterial infection. Once we have this damage done over here from the viral infection, now bacteria can come along, right? Something like a strep, even staph, right? Strep or staph can come in and they can now cause more damage, and we have a bacterial infection. Okay, so let's just go back to make sure we got everything. All right, so these are the common signs and symptoms. Again, treatment is just symptomatic. Again, if somebody did have a secondary bacterial infection, I didn't put it here, but that obviously would be an antibiotic. Okay, so let's take a look at sinusitis. Remember the three or four sinuses. The frontal sinus is above the nasal cavity. The sphenoid sinus is behind and superior to the nasal cavity. The maxillary sinuses, they're in the upper jaw. Those are below the nasal cavity. And then we also have the ethmoid sinuses. Those are just on the side walls of the nasal cavity. So any one of these sinuses can become inflamed, and the job of the sinuses is to moisturize the air that we're breathing. So when we have a sinusitis, the sinus is obstructed, right? The drainage of the fluid from the sinus is blocked. from going into the nasal cavity. So now that causes pressure to build up. And again, I'm sure as part of a cold or you may have had a sinus infection, right? You've had pressure in those sinuses. Now, sinusitis is a bacterial infection, again, secondary to a cold or even an allergy. It could be pneumococcus, streptococcus, or Haemophilus influenzae. So these are all possibilities. As far as the signs and symptoms, one of the things patients tend to present with or complain about is that pain in the facial bones, that pressure, especially if you bend your head down, that type of thing. They'll have the nasal congestion. And again, with a bacterial infection, a fever, again, that may be a little bit higher than with a viral. So they do a procedure where they can just take an X-ray, or they do transillumination, where they actually take a bright light and bring it up against the sinus and see if they can see the light coming down into the oral cavity. And that basically tells them, if they don't see the light, that there's inflammation inside the sinus. Okay, and then as far as the treatment, it's just going to be antibiotics with a bacterial infection. Right? They may give them some decongestants to help clear out that area. So the next upper respiratory tract infection, what we commonly call the croup, but you can see here the medical name is laryngotracheobronchitis. So obviously it's going to be affecting the larynx, the trachea, and even the bronchi. This is a very common infection. It's a viral infection in children 1 to 2 years of age, and the virus is the para-influenza virus and the adenovirus. The adeno group here, the adenovirus also causes the common cold. And that's what happens. A lot of times the croup will begin as an upper respiratory infection, and then that spreads to the larynx, and then that becomes inflamed. Then you know that the larynx is our voice box, and this is where air is moving through the voice box to get down into the trachea and the bronchi, and ultimately down to the lungs. So if the larynx becomes inflamed, right, that's going to definitely pose a problem as far as getting air down into the lungs. So the larynx becomes obstructed, and we now get something known as inspiratory stridor. This is a very high-pitched sound, and you can hear the individual really struggling to get air in when they take a inspiration or inhalation, right? So it's a high-pitched sound on inhalation. Croup tends to be worse at night, right? But the good news is that it's self-limited, right? It's a viral infection. Our immune system takes care of it, and we usually get over it. One of the things that's helpful is to use like a humidifier and to humidify the air. Cool, moisturized air helps to open up some of that obstruction so that the child can breathe a little bit easier. Okay, so this is laryngotracheobronchitis, right? Much easier, croup. Now this one is a little bit more serious condition. This is known as epiglottitis. Now, just to review, we know that the epiglottis is it's like a flap of elastic tissue or cartilage that comes down over the voice box or the larynx every time we swallow, right? Either just normal swallowing or swallowing food or liquids, that type of thing. This is also something that affects children. It's prevalent in the 3 to 7 years of age group. So it's an acute infection, and it's caused by the Haemophilus influenza virus type B, excuse me. It's a rapid onset, so it means it occurs suddenly. So it's a real acute infection, causing a fever and a sore throat. You actually can see this child sitting in kind of what they call a tripod position, where they're leaning forward and they're kind of have their two hands or their two palms down on the chair. It helps them to breathe a little bit better. The inflammation actually makes it difficult to swallow, so they'll drool, they'll have anxiety. And like I said, this is really the pathology can also the larynx, the epiglottis is part of the larynx, so the rest of the larynx can also become inflamed, the area above the glottis, and then again the epiglottis itself, hence the name epiglottitis. All of that swelling may cause obstruction of the airway, and that becomes a definite problem. Sometimes the larynx will actually spasm if the area is touched with instruments. Say they're going in to look, that can actually cause laryngospasm. So since the individual may have obstruction, they want to make sure that they are getting plenty of oxygen, and they'll do antimicrobial therapy as best they can to prevent any secondary infection. So here's a table. We haven't done bronchiolitis. This is a lower respiratory infection. So let's just kind of compare croup and epiglottitis for now, and then we can always go back to this when we do bronchiolitis in a separate lesson. This is, like I said, a lower respiratory infection. But these are three conditions that are common in children. So if you take a look here, croup, right, 3 months to 3 years, and then epiglottis, kind of where this left off, epiglottitis takes up from 3 years to 7 years. Again, this is just different types of viral infection. It causes inflammation of the larynx and the trachea, and ultimately can obstruct the airway. This is a gradual onset, and again, one of the main features is that inspiratory stridor, that high-pitched sound. I didn't mention in the previous slide a barking type of cough and hoarseness. The epiglottitis, again, this is going to be inflammation of the epiglottis, and then again, the supraglottic area, the area above the glottis. The glottis is the opening in the larynx where air passes through. But compared to croup, this is a more rapid onset. So the patient will have the drooling, they'll have a fever, they appear more ill, rapid respirations, and you can see that tripod position. All right, we'll save this for one for the a future lesson when we talk about the lower respiratory infections. Okay, so depending on the time of year, you see a lot of times in the fall time, we kind of watch the flu, right? It's kind of like a flu epidemic, usually most of the time in the fall, and then it's kind of spreads into the winter time. So let's take a look at influenza or the flu. This is a viral infection that affects both the upper and the lower respiratory tract. One of the problems is a lot of times there are secondary infections where the individual gets something like a viral pneumonia, right? So this can be quite severe, and as a matter of fact, it can be fatal, right? A lot of times people do die from the flu. So we're going to kind of break the flu down into three causes, three groups of influenza viruses. There's A, and I'll just flip to the next slide, B, and C. The most common one, right, the most prevalent is the type A virus, right? This is a RNA virus. This is something that the myxovirus group, right? But this is an RNA type A virus. And one of the things that happens is this virus frequently mutates, and that is the reason every year there's new strains. And when people get their flu shot, it's a matter of luck. Do they have the correct strain for the virus that year? And sometimes the viral flu shots work better than other years, and it's just because of the fact that these viruses are so, they just change all the time. Right, so type A is the most prevalent one. Type B and type C you really don't hear about too much around here, where we are, but they just know that they exist. So how does the virus, enter your body? Basically, it comes through the respiratory system. So it's going to enter the cells in the respiratory mucosa. Again, these are the lining of our respiratory system. And then they're going to replicate and cause inflammation. And again, kind of like the cold, also cause necrosis. So the inflammation may even spread from the say the throat area, the nasal cavity, into the sinuses, the pharynx, and then even into the auditory tube, making its way into the ear. And since there's necrosis going on, there's always that possibility of a secondary bacterial infection, right? So that's always a possibility that we have to worry about. That's why a lot of times when somebody does have the flu, they may even get a prescription for an antibiotic just to prevent a secondary bacterial infection. Okay, so when somebody has the flu, what are they feeling, right? What are some of the clinical manifestations? So this is a sudden acute onset disease where the individual will have fever, chills, right? They're very fatigued, headaches, right? Generalized achiness, right? Everything hurts, sore throat, an unproductive cough. That means they're not bringing up any mucus, right? Sometimes we just call that a dry cough, and they'll have nasal congestion. And as I mentioned earlier, this can spread to the lungs and develop into a pneumonia, and it potentially is fatal, right? A lot of times the very young, little children or the very old. So again, this is a viral infection. There's not a whole lot that can be done for the flu. So a lot of the treatment is just symptomatic and supportive. If there is a bacterial infection that they know about, they will, like I said, they will give an antibiotic. Some practitioners do give an antibiotic prophylactically just to prevent it. And there are antiviral drugs. If you can get it early enough, there's something known as Tamiflu. They found that it's helpful to reduce some of the symptoms and the length that the flu virus or the individual has the flu. Right, and it also reduces the spread of the infection to others. One of the biggest things as far as prevention is just respiratory hygiene. Like I said, covering your mouth. Some people in the wintertime even just wear a mask. They wear the like a surgical mask, that type of thing. And again, it's always helpful if you get the flu vaccination to prevent from getting the flu. Many hospitals, nursing homes, even doctors' offices, they mandate that their staff get the flu vaccine, and if they don't, they have to wear the surgical mask, all flu season, so that kind of means, kind of like maybe October, November, December, January, February, that type of thing. So it's a long time to have to wear a surgical mask. Okay, so the last upper respiratory tract infection you want to take a look at is a bacterial infection, and it's known as scarlet fever. This is caused by a group A beta hemolytic streptococcus. An example of this is Streptococcus pyogenes. And what you see is this characteristic strawberry tongue. This is a picture from our book, kind of has that, looks like a strawberry appearance here, the white with the little red dots. They'll have a fever, sore throat, chills, vomiting. Again, kind of signs of infection, of a bacterial infection, abdominal pain, and malaise. And since it is a strep infection, they will do antibiotics. Okay, so those are some of the upper respiratory tract infections. In the next lesson, we'll move down to the lower respiratory tract.